your patient's heart is racing out of control. The monitor is beeping. Heart rate 170s. Orders come in. Give an amiodarone bolus plus drip. You gave it, and 2 hours later, your patient's heart rate is still in the 150s. Luckily, his blood pressure is stable, and the patient has been refusing cardioversion. You called the provider and you received an order of 10 milligrams. Diltiazem. I'd be push and started drip if HR sustained above 110. You pause and think, wait, both together. Is that safe? This is one of those moments that sparks debate at the bedside. Today, let's clear up the confusion and talk about why this combination can be safe and what you, as the nurse, must watch for. Welcome back to the channel where we make cardiology nursing easy to understand. If you've ever questioned using Diltiazem and amiodarone together for rapid atrial fibrillation, this video is for you. Let's break it down in a simple nurse-friendly way. First, why do we even use these drugs for AFib? Persistent atrial fibrillation means the patient's atria are quivering non-stop, and the ventricles can race out of control in response. When this happens, we have two main goals: slow the ventricular rate and, in some cases, convert the rhythm itself. Diltiazem is a calcium channel blocker. Think of it as a pure rate controller. Its job is to slow down the electrical signals passing through the AV node, which is like putting the brakes on a runaway train. This is what brings that dangerously high heart rate from 160 down closer to safe territory. Amiodarone is different. It's a powerful antiarrhythmic. It works on the heart's electrical system to help maintain or restore a normal sinus rhythm. But it also has some rate-slowing effects, which is where the confusion can start. So, why combine them? It might seem redundant, but it's a strategic move. In patients who don't respond to one agent alone, or who are very unstable, providers may choose to layer therapies for better, faster control. Diltiazem starts working quickly to get the rate down, buying you time. Meanwhile, amiodarone has a broader, more powerful effect on the rhythm that builds up over a longer period. It's not about doubling up for fun. It's about targeting different parts of the problem at the same time to stabilize a critical patient. Now, let's talk about the big concerns nurses have. This is where many of us worry. Won't that drop the heart rate too much? Couldn't it tank their blood pressure? And yes, those are absolutely real risks. Both drugs can cause profound bradycardia and hypotension, and we know amiodarone has a long list of interactions and side effects. But here's the key: when providers order both, they are weighing those risks against the immediate danger of uncontrolled rapid AFib, which can lead to stroke or heart failure. With vigilant monitoring and careful titration, this combination can be managed safely and effectively. As the nurse at the bedside, you are the ultimate safety net. Here's what you absolutely need to do. First, monitor that heart rate and rhythm continuously. Be vigilant for any signs of bradycardia. Second, keep a close, constant eye on the blood pressure. Both drugs are vasodilators and can cause it to drop. Next, check your IV site and compatibility. Amiodarone, especially, is a vesicant and can cause serious tissue damage if it infiltrates, so a central line is often preferred for infusions. And most importantly, know your parameters. When should you slow down or hold the infusion? When do you need to call the provider? Finally, document trends, not just isolated numbers. A provider wants to see the patient's response over time to make informed decisions. The bottom line is this: using Diltiazem and amiodarone together can be a safe and effective strategy, as long as the patient is monitored closely by a knowledgeable nurse like you. Don't let fear or misconceptions stop you from providing excellent care. Instead, lean on your knowledge, understand the why, know the risks, and watch for those red flags. You are the one who makes this therapy safe. If this video helped clear up some confusion for you, please hit that like button and share it with your coworkers. And I'd love to hear from you in the comments. Have you seen this combination used on your unit? How did your patient respond? Be sure to subscribe for more nurse-focused cardiology content. And always remember, confidence comes from understanding. Thanks for watching and for supporting my channel.